All right. Welcome back, everybody, and welcome back. We're glad to have you. So, I'll look at put it up here. So, I'm proud. Good purchase. All right. So the agenda tonight. I read the minutes from last time. Does anybody want to make a motion to approve the minutes from the last meeting? Roll call.
Dr. Hassan?
Yes.
Robin?
Yes.
Dr. Brown?
Yes.
Dr. Boxon?
Yes.
Sylvia?
Yes.
Michelle?
Yes.
Alrighty. Next board meeting will be scheduled for September 1st. Woo, first of the month and the first Tuesday of the month. I like it. New business. Let's talk about the budget approval.
Sorry about that.
No, it's okay. You know what? Last time you weren't here last time. It was right in front of me, and I thought it was me. So I just started passing it around, and everybody signed half of it. And there was another one over there that half the people signed. So she was smart. She put the X through.
Oh.
So you gotta.
I was talking.
We forgot to sign what we approved last time.
We had some. Do you want to? Am I any chance to ask them again officially, or are we?
No,
But
we had the questions answered. We were
Perfect.
ready to sign it.
Perfect. Awesome. So let's move to
Yes.
the claims.
Yes.
Okay.
Motion to approve claim. Second.
All right. New business.
Do we need to roll call?
Well,
Do you need to like motion?
Oh, you want to do a roll call?
Yeah, sure.
Perfect. That's it.
Let's not do this.
Yes.
Robin?
Yes.
Dr. Brown?
Yes.
Dr. Boxon?
is this
Yes.
for Pia?
Sylvia?
Yes.
Michelle?
Yes.
Now, wait.
All right. New business. Woo. Would you guys like to take over?
This was regarding my presentation on the emergency preparedness that I did last time. Was supposed to be voted on as well.
Done. So
So this was the proposal for the budget for 2027 that I laid out side by side with our 2026, showing that not much had changed except for we kept a large portion in like a general fund grab from.
was it not already approved by the Board of Commissioners?
It has not been approved.
Okay.
This one runs from July 1st through June 30th.
Okay.
So it's a brand new one.
Gotcha.
Here again, and it's 5,000 more than the year before. So.
All right. So we already heard anybody need a recap by any chance? Perfect. So motion to approve that budget proposal.
Motion to approve the PHEP budget approval. Second.
Roll call?
Call.
Dr. Hassan?
Yes.
Robin?
Yes.
Dr. Brown?
Yes.
Dr. Boxon?
Yes.
Sylvia?
Yes.
Michelle?
Yes.
Perfect.
Thank you.
All right. Cyclist price. I'm interested in this. I want to hear this. I'm excited.
Oh wow. Oh. No, I'd like to know where it's coming from. We have not heard it.
Were you on the call?
No. I did the update.
Yeah.
The slides.
I've been reading it, but not. Time for calls.
Hello, everybody.
Little.
I'm Carrie Patton, Foods Director. Everybody knows Jess. So we thought we would update you a little bit. We give a few nuggets of information about the cyclosporiasis outbreak 2026. This is like our big thing. It is the largest outbreak of this parasite in the United States. It's the largest one we've seen. In a July 28th update, the CDC counted 45 states that have been affected by this this parasite, with the largest cluster being in the Midwest. And Michigan is leading the way with about 10,000 cases, some confirmed, some not, but basically 10,000 cases, and now 2 deaths, which were brought on by, they had complications from other diseases or conditions, and then the cyclosporiasis really aggravated, and dehydrated, and it caused them to pass away. So that was just confirmed.
All right. So for Porter County, that's what you guys are waiting on. We had one case prior to the outbreak, but they traveled to Mexico before they, said it's a national outbreak. So we had one maybe 2 weeks before the outbreak. We've had two. One was international travel. One is a driver and has been all over the state. So he has eaten at multiple places, and we cannot pinpoint down where he received it. We did just get a case today, not confirmed, but this person was tested at an Ohio urgent care. She does have a Valpo address, but most of her medical records are through Fort Wayne, so I think they have a bad address for her. So technically, we have 2 cases, one international travel and one who knows, because I think in the 2 weeks that we investigated, he named 16 restaurants that he ate at all through Indiana. So
He named what? Sorry.
16 restaurants that he ate at all through Indiana. So he's on the road.
Yes.
Do you know whose primary care doctor is by any chance? Are they required to report to you guys if they come across a case? Or
Yes.
The emergency departments? Okay.
And they have 24 hours
That's
to report it to the state.
And then the
Okay.
counts.
Okay.
And then the state bounces it to us, and then we call the patient, do our investigation, which takes about anywhere from 30 to 45 minutes to get where you ate in the last 2 weeks, what you ate, and it goes so in depth to what grocery store, what was the address, when did you eat it, what kind of chicken was it, what was the name brand, or vegetables, etc. So
And then you guys report that to the state.
and a lot of times we're talking to elderly individuals who have a really hard time remembering what they had for breakfast, let alone where they bought things at. So takes a minute.
From the foods division, we work directly with Nurse Shannon that makes all the phone calls when the state reports it back to us. And Shannon and I really have been trying to circle up really often to make sure that we're both in the loop about any phone call I get or any cases that she's had confirmed so that we can compare notes. I get a lot of phone calls with people that say, "Oh, I've been sick. I don't remember where I ate. I don't know. It must be this place, and I ate there and I've been experiencing symptoms for 4 weeks, but I haven't been tested and I haven't this, I haven't that, so it's tough on my side of things. So I always circle up and check to see what has been confirmed and what has come through the state, so I know what restaurants might be affected. It's been interesting.
So what's also interesting is everybody's running to get tested for cyclo. They're all coming back with Campy, E. coli, which is also
Anybody who's had diarrhea for 24 hours thinks they have it.
oh yeah, for sure.
So we've been getting those phone calls.
And then they come to the health department like, "You do testing here?"
Yeah.
Oh, sorry.
And it's not a cheap test.
No, you have to specify.
It's PC. We can run the PCR. It's a GI profile PCR, but it's a $2,000-3,000 test.
Yep.
I think they're recommending that a person be symptomatic for 14 days.
Yeah, but I mean,
you can't.
you're gonna get off on withholding with the patient when they're adamant that they,
I know.
And the problem is that the treatment is specific because it's Bactrim. It's not your usual GI pathogen antibiotic. So
And we still don't have any guidelines for the
Sulfa.
right.
Yep.
Absolutely.
baby Cipro.
Yeah. Which is just unfortunate.
Yeah.
And in all my reading, I have found nothing other than that. Doc and I were talking about that today.
Yeah.
And it was like, I haven't ran across anything.
Right.
Recommendations either.
And it was supposedly, I know we're going off on a tangent, but it was supposedly the lettuce Taco Bell, but that's been also debunked at this point. So
Well,
who knows?
whatever was
Kind of.
supposedly the iceberg from Mexico, Taylor voluntarily recalled. That was as of July 17th. So we passed the dates that should be
Yes.
the issue.
Right.
So cases are still exponentially rising.
Yes.
So I think that's the unsettling matter.
Right.
Mm-hmm.
Just out of curiosity, is is there anything given to like our commercial foods establishments in terms of anything that they should avoid or do?
Not especially, no.
Okay.
So this is where it gets really interesting because restaurants 30 years, as a GM ordering kitchens. So you see where your product is coming from when it comes off the truck, and you can see product of Mexico, product of Chile, Argentina. So it's not unusual to see that produce coming from
Sure.
subtropical regions, which is where that parasite comes from. It's endemic there, and it's endemic in Latin America, Asia, and Africa. The parasite is, it's only transmitted through people, through human feces, and it's
Fecal.
not person to person. It is in contaminated water. So as they're irrigating these crops, I mean, let's say it, most of it would be from Mexico. All these big companies with the high demand of produce, especially throughout the year, they're trying to find these places to grow more and more and more and will produce enough. So we are getting our produce from subtropical regions. And where the local populations in Mexico or other places do have some sort of a, let's call it, immunity, where the kids may have symptoms, be symptomatic, but the adults, even if they have it in their systems, they don't really exhibit very many symptoms because their bodies are used to it. We get a little bit of it and boom, it is not native to the United States. So we're
Right.
getting hit hard. So it could be coming from a lot of different areas from dirty water just getting on our produce. There is nothing that you can do to get it off.
Yeah.
You can't. It's all about prevention of contamination of groundwater.
Kill by heat.
Yeah, but I mean, on
Yeah.
lettuce, you're not going to get that off.
Exactly.
That's the problem.
And that's why we're seeing that up
I've had that
the
question.
summer is
Yeah.
everybody's eating this produce fresh. So unless you heat it to 100, they say 160, 158 kills the parasite, but 160 is what they're saying. You're really not guaranteed to be safe from it.
Yeah.
And we all know that there's a very wide spread of onset time. It could be a couple days, it could be a couple weeks. And that's what has presented the most challenges is supply chain for tracking and the fact that it takes so long sometimes to come on. And then it can irritate other conditions. So it's making it worse, or it's this or that. It's crazy. So it's a very interesting parasite. It has a very hard shell, and until it actually this is what I didn't know about. This is interesting to me. So maybe you guys did, but once the oocyte or the pod on the surface of the parasite, it passes through, it's in the water, it gets into the soil, it has to sit there and mature before it's even before it'll do anything to your system. So it's interesting that, let's just call it fresh contamination from fresh fecal matter, wouldn't really do it. It has to be somewhere where it's been in the soil or been in the water.
That's why the bagged items have been more problematic because that's where
Right. It's sat.
Yeah.
And it like does its thing, right? And the cold temperatures don't really slow it down, although it does like to mature in a warmer climate. I don't think that's cold enough to really, it doesn't do anything to it really. So it's been very tough. And aside from that, the key takeaways for all of us is that they say that extensive outbreaks this year in 2026 may just be a bad run of luck where a huge, crop was contaminated and got to a lot of people from fast food restaurants and stuff. So it might just be a bad situation. But one of the things also that they say is that because of funding changes and the fact that FoodNet, the system where they track CDC, FDA, USDA, EPA, that's their surveillance system for a lot of the foodborne illnesses. And those 5 things that they took out, one of them being cyclospora, they haven't been tracking. So it kind of got away from everybody very quickly. And no one was really noticing what was going on when it started. So tracking has been hard. we know that importation of fresh produce from those endemic areas is a huge problem, but because of demand, I'm not really sure how they're going to solve that problem. And, there has been a lot of talk about the warming climate as well, and the torrential rains and storms that we've been getting, and how that is, contaminating with the water, that's that influx of water, and it's contaminating these growing areas as well. And that's contributing to the rising number of cyclospora cases. So, cook your food and just remember that you wash your hands, and encourage everyone to wash their hands, and maybe start gardening. I mean, might have to get back to a little bit more of that seasonal eating to prevent stuff like this from happening, or just do our best. But there's no cure. It's going to be tough.
Well, thank you. Very informative.
Yeah, thank you.
All right.
It's been interesting, the foods department lately, with phone calls.
Hero Taco Bell.
Well, I will tell you, I was going to talk about this, but then Dave said Colby was going to. So,
Well, we have Dave this morning went to a second reading on both of the ordinances that we proposed over the last couple of months. And that's the tattoos, and then I'm going to call it just the general fees update, fee schedule update. So we drafted those as different kind of ordinances. We had a lot of concerns that we needed to conform to whatever it was that the county attorney did. There's actually no problems with that from the county attorney. So they just grabbed what our ordinance format was. They put it in front of them last month for the first reading. Second reading this morning went well. No objections. We have effective dates now for our ordinances of September 1st. And that will also be the effective date of any of them that have required changes to annual. So if you have something that has to register annually, that's when their effective date will be for the new fees. And otherwise, the other like one-time, one-off, or fee-for-service type things would be also September 1st. So I'm glad that they gave me that. That was Dave telling you to let legal take credit for the things that we do.
yes, great job.
Legal is great at taking credit. So the ordinances are now moved all the way through the process, and we're ready to go.
Very good.
Am I going to pop back in, or should I just do my whole legal?
Why don't you just finish it off? Let's
Yeah,
just do your
I
talk.
don't have a ton of. The other thing we wanted to do is this is. I don't know if I've talked about this previously, but we have a lot of issue with reporting for pools. There's pools that have to do their regular reporting. We had some issue with Valparaiso High School.
Pools?
Yeah,
Yep.
the regular
High school pool.
Swimming.
So if you were sending your kid there was not testing at the Valparaiso
Nice
High School. It is a nice pool, and there was no big reason for them not to be doing it. It was not going to be a problem. And for a long time, we had just compliance issues, and other schools were doing this compliance. So but we're up to date now for the first time in I don't want to say how long to the board. I actually
All good.
it's because I forgot it, but that more than anything. But I want to say it was like 2 years, 3 years.
How did it come to our attention?
It came to our attention originally. This is a weekly testing. Is that correct, Dan?
It's weekly bacteriological testing. So the state code requires that pools once a week pull, whether they're seasonal or year-round pool, they have to pull a water sample once a week, and they have to have it tested for total coliform, E. coli, and heterotrophic plate count. And if coliform or E. coli is present, or the heterotrophic plate count is over 200, it's considered an unsatisfactory sample. And the code states if you have 2 unsatisfactories in a row or 3 in a 6-week period, you have to close your pool down until we receive a satisfactory result. And not testing counts as an unsatisfactory.
Gotcha.
So this is something that we've kind of been discussing. We've been going back and forth, and then we remind them, hey, we haven't gotten your testing and stuff, and it's something that, you know, we went back and I think I brought it up before, and we looked into it, and then I don't know.
So they're supposed to report this to you every week.
Correct.
And
Yeah.
so where's your power? Like, if this doesn't happen?
Well, then we shut down their pool, and that was kind of the big thing was, and I think that's where the hang up was, just like, I was ready to go in there and like, all right, we're shutting down this brand new pool at high school, and everyone's like, all right, let's put the brakes on that, and let's figure out what's going on. So,
of course it is.
You know, because it's a widely used pool there right now,
absolutely.
and, you know, and all that. So
Like,
we kind of like,
But
let's
I mean,
make some phone calls and stuff.
Yeah, because you don't want it to get to that point, right?
Right.
So there's
And some of it was originally there was some amount of concern of what kind of access. It could be a lot of times you're talking to somebody who doesn't know where to go for the testing that they're required to do.
Right.
So we gave them direction on that previously too, and some of it was just putting together a way for them to basically. The solution for this was saying they're not going to blame us at the health department. They're going to blame you if you have a long-term shutdown of the pool, and that was somewhat the context of. And I did not send that letter. Dave sent that letter, but basically to the fact, which is you're going to be in a lot of trouble, and you think that we're gonna. This is how we're going to resolve this in the future. Is we shut down your pool, and I didn't know. It took a while, obviously. 3 years, not how long you wanted.
Well, that's what I'm saying. If there's something we need to do to make sure that it doesn't get to
I feel like that is
point of threatening to
Yeah,
shut the pool,
totally.
but I also don't want
This
them
is
to ignore
something
us.
they were doing it up to a point, and then they stopped.
And some
I
of
don't know if
retired or
I don't know.
Yeah.
actually
doing it for years.
that's my understanding.
Most likely. Probably.
This
Is it in charge of the school? Is it part of the swim club? Like, who's in charge of
Something
it?
changed,
Yeah.
and then it just stopped. And it was a reoccurring thing where we kept talking to people about it, and then
So
You just gotta show up.
what I will
Show up.
say is it kind of got dropped, and then we've really actively been working on it for about 6 months.
Good.
Really, Colby? Would you say?
that was that'd be a good timeline. It was. I mean, as far as like, was it raised? It was raised previously, but it's hey,
Right.
you guys need to be back on a schedule of this because I actually did see something when they stopped getting it. There was at least a reminder that hey, we didn't get this. So everything again from our team was appropriate as far as whether or not it dropped after that. Well, if you miss a bunch of them, the next solution, you miss 2 of these, the solution should be we shut you down because that's an unsatisfactory result. We probably on the 3rd time where they didn't do it, they take it less seriously because you didn't show up to shut down the pool, and that was what changed in the last 6 months. And it still took 6 months to change it because we didn't get to a point where we are showing up next week.
You need to just show up.
And
We'll get you a
so this is not about. This is not about like this incident particularly, but how do we avoid this in the future, right? So that's really more the question here. Like, what needs to happen in these scenarios that you guys have the potential? And I understand. Look, my kids swim in that pool. They participate in the summer swim program, so I don't want to shut down either. But at the same time, I mean, it's important. So, like, what are we missing here? What can we do to potentially keep this from?
Well, I think
Right?
children, like threats, and you have to follow through.
Right. Yeah.
Disciplining them, and they kind of,
Right.
you know, like it's unfortunate. Like we don't want to do that, like you say.
And the ultimate reasoning is
I do think it was
safety.
the perfect storm of
Keeping people safe.
me coming on
Gotcha.
and then it getting brought up to me and going, okay, this is something we need to do, and then Dave gets a knee replacement. And
Gotcha. All right.
Just
Perfect.
timing.
Okay.
That makes me feel better.
Fair. But now you have the sock with the rocks and you're gonna hit them from now on, right? Okay. All right. Done.
And Dave can walk.
And some of it is
They're on
having
the radar now.
the perfect storm is also the on the other side where you have the school transitioning from changes in athletic directors and changes in because this is literally a responsibility of the person who is in the pool. It's not the athletic director that sends these in. This is people who are maintaining the pool. And if you get turnover in that at the same time you get turnover at the health department, then you got to re-up it. But they were reminded on a fairly regular basis. It's a question of whether or not you want to do the pool. The one thing I will say, I think, if you're talking about like, do we actually have evidence at any point that the pool is anything other than pristinely? And that's not accurate. Like,
Good.
They do have that they were doing the things that they need to do to maintain the pool, which probably would have resulted in these. But the basic state rule is you miss testing, you're unsatisfactory. That doesn't mean that there's any actual evidence.
Yeah, I would think that you would have been in there if it was unsafe. You would have.
And this is
You would have
different
gone.
than their like chlorination and stuff.
Right.
They were doing their chlorination. They were documenting that and recording that. This is separate from like their day-to-day chemical testing. So.
And I just because I'm curious now, and I know it probably doesn't need to be rash, but is does somebody from our department go in? Do they self-select the person? How do they test the pool? Like who? How do we know that the person tested? You know, just out of curiosity.
They either need to have someone from like that is employed there pull the sample, or there's third-party companies that will come in. They will take the sample and they will take it to a lab.
Okay.
Or some of the labs will come in and pull the sample, or someone from your staff goes in, pulls the sample, and then drives it over to the lab.
And they were
So that's
and they were presented. They were presented
the person, the procedure, and the expectation. Like those are the three things, right, that need to be in place so that going forward, it's done.
And we identified, 6 months ago we actually had a consistent amount of people within the last 6 months.
Okay.
So to at least identify who from here and who from there, and then the procedure was explained to them, including that you use your own lab, you get your own testing, or what are here are the alternatives. That was explained to them probably 3 months ago.
And then the expectation is that there's going to be follow through.
And they explain at this point
some sort of consequence, because if there is no consequence, there won't be any change of
Well, especially if after 3 months, I'm told what to do,
Exactly.
don't do it, and I drag my feet for 3 months, then you deserve to have your pool shut down.
Yeah. I mean, you have threats.
and
Yeah.
the other than me telling them
Right.
that this will occur, it's a question of, do we want to send a bunch of people over there to shut down the high school in the largest city in the county's pool?
I get it. It's like sure, I understand, but
So
Nobody
You're-
wants to be the bad guy.
yeah,
Nobody wants to be the bad guy.
And that's generally
No, nobody wants to close the pool. But if you know you're supposed to do it, and
you thought it was unsafe. You
have to.
Yeah, of
And if
course.
you get to the point where we close a pool.
Right.
Well, his kids
generally,
are
when we
swimming
pull a
there.
permit or something, we usually consult with
the
Dave Colton first. And be like,
But
okay,
it's-
do we go in there and just close them, or do we want to handle this a different way? So.
Well, especially if the other schools in the county are following the procedure, they're doing what they should be doing, and their pool is open. Like, what is their, what's the incentive to continue to do it? I mean, we want to make sure that we're treating everyone equally. So if one school doesn't have to, why do the others have to? Portage High School is bigger, isn't it? Doesn't it have more students?
It does, yeah.
Yeah.
Understanding, but
Very large.
It's going. There wasn't any indication of
Right.
the problem other than without.
Other than without, okay.
And again, I'll emphasize,
Sure.
there was no indication ever that there was any kind of
Any problem. Okay.
And they were doing and monitoring their daily testing.
Not reporting all
They just weren't reporting this very specific
okay.
test.
That the state requires.
Yeah.
Well, I would be paying close attention to them from now on.
We're waiting to see if we
Now on. Gonna be the pool, please.
I'm sending you over there.
Oh, right.
So, there's other some affiliate agreements that we have that I talked to you. I don't know if I talked to you about Elmhurst University. At least there was.
I saw the email.
Okay, there's just one additional we have a couple of different people where we have university cooperating agreements. Most of the time, it's not an issue because these are Indiana companies, but you get a handful of them from Illinois because we're close enough that that'll happen. I have not seen any Michigan ones. Illinois, I actually am a licensed Illinois attorney, so I can do stuff with this. But Illinois university, like Elmhurst University, is one of them that has circulated an agreement. And every single time they circulate an agreement, they say, we want this to be Illinois law and, Illinois jurisdiction. They have choices of jurisdiction or choices of law clauses in each one of these. And they're asking whether or not that's a deal breaker. Would it be a deal breaker for me in ordinary, this is a state agency, like this is part of the government.
Yeah.
And usually I'm like, if you want to try to bring something, if there was some kind of lawsuit, would you want us to travel to Illinois to be able to have the Porter County Public Health Department in a lawsuit with somebody in Illinois? I don't think that's a practical thing. They should, if they're coming here to look to have any affiliation with us, they should anticipate that you're going to, if there is something that happens, Porter County is where you sue, and it's Indiana law.
Yes.
If we were Taco Bell buying lettuce from Mexico, you can decide where you want that to be. But but this is the health department in Porter County. Expect that if we have a problem with our contracts for our affiliates, that you'd probably at least be in Indiana.
What kind of affiliation are they looking at? What is it?
This particular, you can explain the full amount of it, but it basically is they're going to have employees that are part of their university system that are here in Porter County.
It's a clinical rotation for
Yeah.
I gotcha.
It's what?
A clinical rotation for nursing students.
Yeah. I would think of it as being not anything that I would be concerned of that there's actually going to be a problem with.
No, but you want your.
But still.
Yeah.
No, but if something does come up, you don't
Yeah.
have to go
And
there.
we're totally fine with that.
Yeah.
Yeah, because it won't be us dealing with it. It'll be like 30 years down the road after we're all retired and being like, what the hell did those guys in 2026 do to us?
It'll be Dave still doing
Right.
And this is to benefit their students and to provide their students with a service that they cannot find in their own state. So if they're looking outside this far away from Elmhurst University, then they want that experience, then they should follow our law.
Well, and again, this is a public entity.
Yes.
We're not a private entity. So
Right.
These aren't negotiable things.
And I'll emphasize the probability of anything actually wrong is almost zero.
Yes, but it's just.
But
it's the principle.
because we actually part of what we're doing in this is we're not responsible for anything that goes wrong with the clinical experience, and you have to indemnify us for anything with regard to this. And the only thing we have to do is keep ordinary insurance that we would keep otherwise. So this is the type of agreement that really doesn't put us out there, but it's still for the benefit of the students that are our students, and so I actually do think that when these come up again, if they're asking whether or not we need to have this be Illinois, it's not really, it doesn't cost us anything to say no.
Yeah. I mean, they're asking us, and furthermore, it's a precedent, right? Because I'm sure that with the universities, especially considering we have several higher education options and opportunities here, and we do. I mean, hell, we have. I take medical students, for example. So at the end of the day, I can foresee that being something a precedent set in the future. So if you say yes now, then well, next time it's a yes too. So we have to be consistent.
So I'm gonna. As far as whether or not it was a deal breaker, I would have done whatever the board wanted to do, but I'm going to say that it is a deal breaker if there's just an out of state.
There's nothing wrong with making it easier.
Yeah.
Totally.
I mean, let's take a vote as far as agreeing that we stand on the principle that they have to abide by Indiana law. Does anybody want to? I put that motion forward.
I second.
Can we take a roll call on that?
Dr. Rosano?
Yes.
Robin?
Yes.
Dr. Brunt?
Yes.
Dr. Foxen?
Yes.
Sylvia?
Yes.
Michelle?
Yes.
Done. You can go back to them and tell them we said no.
Thank you for that attention to detail.
No,
Anything else?
So I do not think. I think that's all I got.
Were you
Oh.
doing anything with emergency preparedness contract, or is that next time?
I have, other than we are going to have one, and it'll be a seamless transition retroactively when we have that contract. Because I talked to Dave, like I said this morning, we got back from there, and I asked him whether or not we had a contract. We have a contract from when we did this last year. Actually, despite the fact that this ends at this goes from July 1st through June 30th, the state funding and preparedness on this contract is almost always a couple of months behind.
Yeah, we're
This
never
is
up.
actually significant.
Oh yeah, we're never.
We're
never
ahead.
last.
Yeah,
We're never
this is
the
pretty
last.
good. Yeah.
So we will backdate the contract for them based on the state funding and put our contract together with the new 5,000. And I anticipate probably be signed and ready to go next month.
Great.
Because I believe that we passed, that we're fine.
We did, yeah.
So I wrote that down at least. So hopefully, and so we'll have the contract ready to go. Okay, just approve it.
Great.
Perfect. Well, thank you. I guess we're gonna go back old business. Any issues? Perfect. And then we're gonna. I stepped out of line earlier. I did the claims and receipts as part of the budget, but we already did the claims and receipts, so we're gonna skip past that and then health officer and staff. Anything you guys would like to bring to our attention?
Talk about the baby shower. The date, just reminders. That's
October 30th, baby shower at the expo.
Dr. Weaver's coming as well.
Ooh, the state. Okay, because there's a few Weavers. So I just wanted-
Yeah, she's coming up. She's doing several site visits, but she's going to Lake County before she
When
sees
is it?
us. And so,
she's doing.
Friday, October 30th.
but that's on her stop, and so we'll be also giving a little presentation while she's here.
Yeah, it's more of a conversation, I guess. So it's going to be. She's going to visit 2 counties, come to our baby shower where they're inviting elected officials to that.
Will you?
And we're going to have an hour and a half conversation afterwards with her and some of her staff and what the things that we're doing. So if you are all invited to come if you would like to. So I have not sat through one of these, but I hear it's just a conversation about how we can do things better and how they can help us. So.
Perfect. It's a Friday. Wonderful. Perfect.
At the Expo Center.
At what time? What time would we need to be there for that?
Yeah.
So the baby shower is 11 to 2, and then it would be 2 to 3:30.
Okay.
And we are last on her agenda, so we are hoping that her having been to our baby shower, maybe she'll be ready to go home.
She will be.
Right.
Yeah,
Because she will
Drive home and it's
I think
ahead.
she was
Friday
going
night.
to Fort Handley before.
Zoom.
Oh, okay.
So it'll be later in the afternoon. You said
Yeah, it should be like
2:30.
3:30 would be the guess.
At the expo or here?
Expo.
Okay. Perfect.
Do you have anything else?
Nope.
Then I will go next. Just a couple of things. We were at the fair for the last 10 days. Jess ordered our decoration for the fair. Carrie Batson and Tara decorated, and we.
Wow.
Never would before, but
Well, we did.
we did. So,
Well, there you go.
and then also, I would like to invite all of you to walk in the Popcorn Festival if you'd love to. In the Popcorn Festival, we would like as many of you as would like to walk in it as possible. So if you would like to come, we're going to be handing out popsicles through the parade, and we should be pulling the giant billboard for that we have through the Suicide Prevention Task Force, and so we'll be pushing that agenda, which is a good thing. So
Our float is Woodstock themed.
Oh, cute.
You gonna be wearing flowers? We're gonna do flower. I like it. Flower child.
Oh, and if you didn't see the picture, where there's a new AED at the Expo Center, and there should be a second one how soon?
Awesome.
Great.
Beautiful. Thank you. Anything else, guys?
I just want to mention the state is working on an update to the subject code. I've been putting it in my monthly report, trying to keep you updated. But there's legislation passed last year that said they had to update the residential code by July of this year. It didn't quite hit July. They're shooting for September. The second comment period is right now. The public meeting is this Friday. I'm gonna just jump on and watch it and see if anyone has any comments. But they're updating some definitions. They're adding some things into the code and stuff. So we will have a new septic code updated. Hopefully in September is what we're shooting for. So.
Thank you. All right. I guess that brings us to the public comment, and I don't see anybody out there. So to that, can I get a motion to adjourn?
Motion to adjourn.
Perfect.
Second. Yep.
Beautiful. Thanks, guys.